Well, I'm really delighted to be able to introduce our new 5-year shared delivery plan, because this is going to be the roadmap to deliver our integrated care strategy, improving lives together across the whole of Sussex. And I think this important milestone is critical because for the first time we've got all of our partner organisations to sign up and commit to deliver their particular contribution to the delivery of this plan. Now, because there's many things that we need to do, we also need to recognise that there's some short-term issues which we need to fix, as well as some long-term. And this plan brings both of those together. So what we've done is to compartmentalise the plan into 4 different components. We've got some long-term improvements, we've got some immediate improvements, some continuous improvements, and some local improvements. So let me just tell you a little bit about each of those 4. Now, when it comes to the long-term improvements, these were articulated in the 5-year strategy itself. So it's developing integrated community teams, it's developing and growing our workforce, and it's making better use of digital technology and data. Now, that's great for the long term, and it will take us 5 years to put all of those things into place. But in the short term, we've got some more immediate things to fix. And so they revolve around improving access to primary care, for example. And that's not just general practice, that's pharmacy, it's optometry, it's dentistry, it's the 111 services. But also we need to improve our urgent and emergency care as well. So that's improving our response times to 999 calls and reducing the waits in our emergency departments. And then, of course, we've also got to look at our planned care and reducing the backlog that developed over COVID. And what we're intending to do there is very much to reduce the waiting lists for diagnostics, for operations and other treatments that might be needed. And then finally, of course, when people have actually had their particular treatment in hospital, we need to speed up the discharge process so that people can actually get back home as quickly and as safely as possible with the right level of care wrapped around them at home. So that gives us the long term and effectively the short term. And we need to do those immediate improvements this year. Now, there's other things we need to do that will need constant attention. And so our continuous improvement priorities involve things like reducing health inequalities, both in access, experience and outcomes across our communities. We also need to think about how we can improve access to our mental health services, including learning disabilities and also autism services. Then, of course, we need to think about clinical leadership, because we can't improve the services without empowering our most experienced clinicians to improve the services that they're responsible for. And of course, we have to look after the money. So, NHS Sussex receives a huge amount of money from the government, so we need to make the best value possible of that, and also think about working with our local authorities about making the best use of the public sector finances that are available. And then finally, we need to work with our local priorities. And this is building on the partnerships with our 3 local authorities in Brighton and Hove, East Sussex and West Sussex, and making sure that our plans also meet the requirements of the health and wellbeing strategies in each of those areas and meet the appropriate needs of those local populations. So you put all of that together, that gives us a real opportunity to turn our strategic ambitions into a reality, and that is improving lives together.